to our third episode of the Virtual Physiatry Mentors. I'm Dr. Sheena Bhuva.
I'm Dr. Benecia Williams.
And together we are
Shanisha. We're so corny. I love it.
I do it every time, guys. Get used to it. All right. So we've done 2 episodes here, and our first episode was the introduction of just Benecia and myself talking about what we want to do with Virtual Physiatry Mentors and kind of going into a little bit about how we got into this field and what we're doing now. And then last week was a great discussion with Dr. Omar Salad. He's one of our mentors and mentor to a lot of other medical students and residents. And so he went into detail about, just what to expect as a medical student and even as a resident. So that was great. But today we've got another special guest here, and I'll kind of let Benecia introduce our guest and we'll go from there.
Yeah, so we have Dr. Nicolet Finger. I met Nicolet as a medical student where she rotated into our office. So I'll let her give a little bit more introduction about herself and her journey into medical school and PM&R.
Yeah. So hi, I am now Dr. Nicolet Finger, and soon to start my intern year. Yeah. And so I kind of always wanted to be a doctor, but I didn't really know what that meant for me. I think I just liked the idea of it, but didn't really know why. Didn't have a reason yet. So I did my undergrad at UT Austin, and I majored in nutritional science, mostly because I was interested in it. And I knew that if I ended up not going to medical school, it would be something I would enjoy. And then, decided to apply to medical school after that. So always been really interested in nutrition and fitness. And I think that plays, a big role into why I ended up in PM&R.
Nice.
For sure.
So you were in medical school and you went to TCOM, right, in Fort Worth.
Yes.
So how did you come across PM&R and how did you know it was for you?
So I didn't know what PM&R was coming into medical school. I actually was pretty sure I was going to go into OB-GYN, which is a completely different field, obviously. And I did my OB-GYN rotation during my beginning of my third year, and it just wasn't for me. I liked it, but I didn't come home excited. And that kind of scared me because I want to love my job. And so I started speaking to friends and spoke with one of my friends who was a year above me, and he was going into PM&R, and he actually was being mentored by Dr. Salad, who was on, this live last week. And he just said, why don't you just go talk to Dr. Salad? Why don't you just go have a meeting with him, no pressure, and just see what it's about. So I walked in completely, blind. I had no idea what PM&R was and just chatted. And
I remember the day you came into our office for that meeting too.
Yeah. And I just asked him a lot of questions, picked his brain, and he said, do a rotation with me and just see if you like it. So I did. And I after 3 or 4 days, it was very clear. I was coming home excited, like wanting to call my family to be like, guess what I did today? Listen to how great the specialty is. And I think that just, that showed me how much I loved it because I was that excited to be there.
Very good. Now tell us, someone had sent us a question about your inpatient and outpatient exposure for PM&R. Can you talk about some of your experiences for that and the differences you've learned? And I have to let my dog out, you guys. He is sitting at the door crying like a baby. So I will be right back while you answer that.
No problem. Yeah, so outpatient PM&R is probably what most people think of when they think of sports medicine, though you can do pain medicine, general musculoskeletal, and also certain tests like electromyography. So you'll see a lot of MSK patients. And of course, that's, day to day, maybe they had a sports injury they need a test. Inpatient PM&R is really more broad. You see a lot of people after surgery or after, an injury like a car accident or a spinal cord injury, a brain injury, who really need more care than just a visit. And so they stay inpatient. You actually manage their medications, work with other physicians that, if they have had a transplant, you're working with the transplant physician to manage their medications. And then, of course, all the other specialties like PT, OT, speech therapy, which really is why I love PM&R in general, because it's so collaborative.
Mm-hmm. And to kind of piggyback after that, so I am on call right now. So this morning I rotated on our inpatient rehab unit. We had 18 patients, and then I also covered the acute hospital, which we had consults. And yeah, yesterday I had a patient with an abdominal abscess. I had to call the surgeon. I had to order a CT abdomen. I was starting antibiotics. So you actually do get a chance to practice a lot of medicine. At our facility, we actually have internal medicine that follows, which is nice. But like when Sheena and I were residency, we were the internal medicine physicians. Like we rarely had internal medicine follow it in our patients, which leads to having a very good intern year, which you're about to start, because you'll get a very good basis of internal medicine during that year that will follow you for the rest of your life.
Yes.
So it's important to get that inpatient experience if you can.
And even, some medical students aren't aware that inpatient rehab, you can actually do procedures in. So,
Yes.
you are managing the patient's spasticity. So people with spinal cord injuries or brain injuries, in residency, we did tons of Botox, even phenol injections. You do sometimes baclofen pump refills if they're an inpatient. You do EMGs on patients so, even like joint injections every now and then, if it's hindering, them doing physical therapy and, they're not able to get the most out of PT because of their knees hurting or something. So you can definitely do procedures on inpatient as well. So I don't think a lot of medical students, know that.
Realize that, yeah, for sure. You get a lot of that exposure. So let's talk about applying to PM&R. So I put on our post this week that a lot of people don't know. We kind of discussed it before. PM&R is 4 years of residency. Typically, the first year is not attached to the last 3 years. And I would say probably, I think 70% of PM&R residencies are like that. That is called an advanced residency, meaning you have to interview and apply for your intern year the same time that you're interviewing and applying for your physical medicine or rehab year. And then you have a handful of programs. I think there's 20, I looked it up, across the country that have their intern year attached to their physical medicine year. So that is called a categorical program. That's exactly what Dr. Nicolet Finger is going to be going into. And so I'll let you go ahead and kind of tell us about your experience applying. How many programs did you apply to? Did you interview and then rank?
Yeah. So I applied to a total of 40 programs. My school is really good about kind of looking at our application and telling us how many we should apply to. And I was told to apply to 30. And I think out of just fear, I was like, I'm just going to tack on an extra 10 and applied to 40. So that was my PM&R mix. And most of those I applied to were advanced programs. I would say probably about 10 of those were categorical. And so I also had to apply, of course, to prelim and transitional years, which for those of you who don't know are that 1 year program before your 3 advanced years. And I applied to, or I interviewed at 7 of those, applied to about 20 prelim ones. And so ended up interviewing at 11 PM&R programs and ranked all 11. My goal was 12. And I think that's because I read somewhere that 12 was like the magic number and almost guaranteed you to match. But by the end, I had one more interview scheduled that I just didn't feel like was going to be a match for me. And I had already felt so connected to the programs I interviewed with. And I decided to cancel that last interview and just take 11 and give somebody else, the chance at that interview. So then I interviewed at 7 IM and prelim programs, and I ranked all 7. And I actually, in addition to ranking them in my with attached to the advanced programs, I actually also ranked them at the end of my list, which is a strategy that, I was told was a good idea, and it doesn't hurt. It doesn't cost you any more money unless you're ranking, over 28 programs or something. But I went ahead and listed those at the end so that if I didn't match PM&R, I would have at least matched to a 1 year program and could reapply. Fortunately, I didn't have to do that, but
yeah.
Yeah, that was smart. I remember applying, and it's almost like Amazon shopping when you're looking at the list.
Yeah.
You're like, I'm just gonna might as well add that one too.
Yep.
Okay, that sounds good. Click.
Yeah.
Good.
Yeah. So you mentioned 12 is the magic number, and so that's I think that's a good number. So the charting the outcomes they, on the NRMP website, they have all the data from the 2018 match, and it showed with DO and MD students. So DOs, the ones that ranked and matched into PM&R, their mean was about 11 programs, and then MD was 13. So yeah, 12, is a good number. And those that did not match, they ranked about 6 programs. So it definitely, obviously, the more programs you go to, the better, right?
Yes.
Your better your chances. And so it'll be interesting though with this upcoming season. Benecia, I'm sure you remember like getting that email, and Nicolet obviously, like, and having to like sign up like immediately for that spot. So, and like having to juggle, am I going to make this one, or do I want to go to this one in New York or this one in California? You can't do both at the same time. So now that the season's going to be virtual, I actually read a article on Kevin MD that said if whether or not we need to set a limit on how many interviews people can go to, because as Nicolet alluded to, she knew that last interview wouldn't, she wouldn't want to go to that place, and might as well give someone else a chance. So people who are really, really good applicants, they may accept all 25 interviews, and there won't be enough. So it'll be interesting to see how that's going to work. So
yeah, that is very interesting, because you apply to so many when you're so gung-ho when you start, and then you'll be like, oh, I really only need this many. So yeah, I think people are going to accept more interviews because you're not having to spend the money to go on that interview, because it is a very expensive process, buying all these tickets, flying, and you try to be as strategic as possible. Like I remember doing like my Texas tour, like stopping in Austin and then going to San Antonio, and just making sure were back to back, so I wouldn't have to make that trip twice. So it's going to be interesting how they do it this year.
Super interesting. Yep.
Yeah, it will be interesting.
So I like that idea of limiting how many programs you could.
I think that would be fair. So.
And I think another thing to remember is that a lot of those statistics, people, they rank most people rank how many programs they interview at. And so those statistics are most likely based on people who got a lot of interviews. So that's to say, if you get a lot of interviews, your application is probably very competitive, and you probably don't have to interview at all 12 of those programs. Like, even though, and I think that's one thing that I probably didn't feel comfortable doing that. But if I were to go back, I definitely would have, maybe not even done 10 or 11, maybe done 10.
Yeah, and that was actually one of my questions I was going to ask you now. Next is like, if you had to do it all over again, what would you do differently?
So definitely that would be one thing, is be more comfortable with the fact that, if I got 12 interviews, I'm probably okay. I don't need to take all 12. I could probably take 10, and, help some other people out, let them take interviews. But additionally, I wouldn't have applied to as many prelim or IM programs at the beginning. I would have waited until a little bit to see kind of what programs offered a connected, advanced plus a prelim, because some of these are not categorical. They don't list themselves as categorical, but you go to the advanced interview and they say, well, we have this, we have this IM prelim that we're connected to, and we don't even interview for it. You just have to write down you just have to list it on your rank list. And so, I think you can waste a lot of money applying to all these prelim programs. I know people that applied to 80, and I thought I applied to a lot, applying to 20. And a lot of them you never hear back from, because they go with people they know, or people in the region, or at schools that are close to them. So I probably wouldn't have spent that much money on those programs.
Yeah, I remember that being nerve-wracking. Like, I took the strategy, I think only applied to 3 transitional years and interviewed at 3 transitional years. Because I was like, either I'm doing this transitional year, or I'm scrambling into one. Luckily, I was able to match into my top transitional year. But yeah, some people do choose to scramble because there's typically an intern year somewhere. However, some intern years are definitely a lot harder or more difficult. Like I think like a intern surgery year is going to be a very difficult year compared to like a transitional year. So that's not necessary.
I was more nervous when applying. Like, I think if I remember, I applied to 16 PM&R programs. I went to maybe 12 interviews, but I was more afraid for not matching into a prelim year.
Yeah.
Like I applied to 20, 25 prelim years and ended up going to 8 of those interviews. And because prelim, right, a lot of so PM&R is one of the specialties, radiology, I think dermatology or ophthalmology.
Yeah, it's very competitive.
So those are competitive spots, but yes, I think it's great that the PM&R programs, they're adding more categorical, spots, or like how Nicolet said,
Yes.
often there's a prelim year that's kind of attached to the advanced program. So, all right, you guys have questions? Questions?
Yeah. Let's see.
Type them in the comment box.
Yes, let us know. Hi, Dr. Gutierrez is watching. Dr. Zaman, what's up? Sierra, hello. I'm looking forward to, everyone's so sweet. So speaking of intern year, so I did my intern year at JPS and there was 10 of us total, and it was 7 radiology, 1 ophthalmology, 1 dermatology, and it was me holding it down.
You were holding it down for PM&R. I love it.
Holding it down for PM&R. So no, we had, and you get very, very close to your intern class because you guys are in the trenches together. Before we got on, we kind of were giving Nicolet our advice because she's a little nervous to start. And I remember being super nervous. I forgot
everything.
Yeah, because I feel like when you're a third-year medical student, you know everything because you're getting ready for your step. You're on top of it.
Yep.
Yeah. And you're dumbest right before you graduate, because I was like, I'm not doing anything last 2 months of medical. I was in Costa Rica before I graduated from medical school. So then June hits and you're like, oh my God, like I'm a real doctor, you guys. And I have 4 weeks to remember that. But as Sheena was saying, it might have been me. Nicolet, are you frozen? We're like, this is the frozen dance. I think Nicolet's frozen. I hope she can hear us. We can type it on here too. But can you hear us now?
She's back.
Yes, I can hear you.
I know. Okay. So we're doing the frozen dance.
I was like, no.
Like, are we frozen? No, it's okay.
All right, we got some good questions here. So Nick asked Nicolet. So Nick for Nicolet, interested to hear how you prepared for the interviews and what helped you on those exhausting days.
Yeah, so I think what's really important on interview season, and I've said this, on my social media platforms and everything, is reflecting before your interviews. Of course, you never want to be super rehearsed or like you're talking from a script when you're interviewing, but you should be prepared and you should know yourself pretty well. So, this is a time to take that opportunity to, whatever it is, journal, type up in your notes section on your phone or your computer, and answer to yourself some of those most common interview questions. And, I was actually pretty surprised at the positive feedback that I got from some of the interview questions that I answered, because I had spent a lot of time thinking about these things. So when I was asked about my biggest weakness, I answered a weakness. I told them what my weakness was, but I also said, I've been working on this. This is what I do because I know that I have a tendency to do X, Y, Z. And so this is how I overcome that weakness. And it shows that you're self-aware, because if you come in and try to disguise a positive thing as a weakness, people know. And it's obvious,
right.
So I think take the time to be real, be authentic, and what they care about. They don't care about a perfect person sitting in front of them. They want a real person and someone who's going to work hard and do their absolute best. And that sounds so cliche, but it's true. And, so many people will try to come in with a scripted answer or something, and they really just want to know you. And actually, if you go in that way, it takes the pressure off. If you say, I want them to know me, and so whatever I can say so that they know me when I leave this room in this short amount of time, rather than I just want to impress them, that actually takes the pressure off you and lets you be more yourself.
That is an excellent answer.
Yeah. I remember seeing that on your Twitter account. I thought that was really nice.
Very insightful, because that is so true. Because Sheena and I have both interviewed several candidates for residency and fellowship, and then it does come across, you're like, that was rehearsed.
Yeah, don't say, if someone asks what's your weakness, don't be like, I work too hard, please. Like, don't say.
I'm a perfectionist.
Yeah, right, exactly. Okay, we have some other questions. Someone said wanted to ask about the interview process.
Here wrote, so how did you decide on a program? Did you have like a pro cons list, or yeah?
So I didn't necessarily have a list. I heard from a lot of people above me that they tried to do, they tried to make an Excel sheet with all these different categories. How much free food do you get? How much, insurance and all this stuff. And then they ended up not filling it all out, right? So
Sheena, Sheena, did you make an Excel sheet?
I actually did it for this. That's surprising me. No.
I'm like, Sheena did it.
Yeah.
It didn't just
I'm
natural. Yeah.
I'm actually an Excel sheet person, but I made one, but it really was just the program's names,
right.
1 through 11 on the side, and then I put basically try to separate all.
We're
1 or 2 sentences. Let's see.
I think
you losing me?
Yeah,
a little bit. Yeah.
A little bit. Oh, there you go. You're back.
See. I'm back.
Yeah.
Okay. So I wrote, all my programs, and then next to it, I did write a pros and cons, but I just stuck to really 1 or 2 sentences about each program and really what spoke to me on my auditions or interview day. And kind of the things that I was looking for, the things that really stuck out to me in programs were, one, my absolute most important was quality of training. I have no idea if I want to do a fellowship after residency, and so I wanted the opportunity to either do a fellowship or be ready to work right after. So I always looked at their previous residents, and I liked to see a mix of some residents went into specialties and went into competitive fellowships, and then other residents went straight into practice. And I liked to see that balance rather than one or the other, because it showed me that I'll have a good training to do either of those things when I'm done. So that was absolutely number one. Additionally, at the beginning of interview season, I wasn't sure if I wanted a big or small program, but I came to realize that I preferred a larger program because I learn best when I can collaborate with peers. Collaborating with people above you is always helpful, but when you are collaborating with people who are at the same level of understanding as you, that's really where I thrive. And so I wanted a good number of co-residents, which kind of spoke to me. So yeah. And then liked categorical programs. Location was important because I did want to be close to family. And then didactic sessions were important to me as well, that they prioritized those and put effort into good didactic sessions.
No, yeah, those are all very good things to look at for sure.
And it's good. All these programs, you're going to apply to a lot. You're going to go and see a lot, or at least virtually interview. So you have to find like what sets each program apart, because they're going to all like run into each other. You're not going to be like, oh, which one? So it's always good to, take those notes down, like right after your, what your gut feelings are, kind of write those down, because you'll forget, Yes.
And I think that's good. You brought up a good point, because with COVID, I don't think people will have that opportunity to go to see it per se. So I think it's good to kind of know how you learn best. Like, do you learn best? Like, I knew for myself, I learn best like on a one-on-one basis, because I will get distracted with everything else. So I knew a smaller program was for me because of that. Because I'm like, okay, it's me in attending. Like, I have to be on point all the time. And so I think knowing that ahead of time when you are doing your application process and rank list, because like I said, COVID, you're probably not going to get that experience to do the rotation. So kind of start figuring that out now would be advice I have too.
Definitely agree. Yeah. Like same with me. Like I, love Baylor Dallas because it's a small program and I'm like more introverted. So I don't think I would have done as well in a larger program, because I think it would have been maybe more difficult for me to speak up, in a larger crowd. So it was definitely, I felt much more comfortable having like that one-on-one and just having 2 other co-residents where we got along, great. And so it was, I think it's really important to know kind of what kind of situation you learn best in, kind of what are you looking, really looking for in a program. You have to be there for 3 to 4 years. So
it's a long time.
I agree.
Yeah, and I like how you looked at the mix of what people did when they graduated. And I think it's also very, very important to look at what the program's pass rate is for their board exam when you're ranking, because if you have a program that has less than a 95% I would say. What do you think, Sheena? Less than 90% pass rate. Like, you know, you want to see like, what is it the didactic session that wasn't great? Was it the residents themselves? So.
And you can ask, you know, when you're interviewing, be like, you know, why is your pass rate, you know, 66%? Oh, we had 3 residents and one was, you know, maybe going through some stuff and, you know, they weren't, you know, so just because, yeah, I think, you know, definitely look at the percentage, but there's always a reason, you know, why.
Right.
You're definitely.
Right. And I think for several years, you almost have to look at it, right? You can't
exactly.
judge it based off on like just
Trends.
1 year.
Yep.
Right. Trends for sure.
Yep.
Okay. Someone said, hi, Dr. Finger. They said, how did you handle the post-interview communication with programs?
Oh, that's a good question.
So I sent thank yous to almost every program I interviewed at. I think for me, that's just standard etiquette. What'd you say?
Handwritten or email?
Emails.
Okay.
I handwrote mine. No, I'm a nerd. I handwrote the ones I really wanted to get.
And I got mixed advice on that, but I had a lot of jobs, like I say jobs, no full-time jobs, but a lot of part-time jobs before medical school. And I always wrote thank you emails, you know, to anyone I ever interviewed with. And so that was just standard for me. Because they took the time out of their day, you know, from their jobs to do that. And so I would send thank you letters. And how I did this was at every interview, they usually kind of gear you towards how they want to receive a thank you. So they'll give you a sheet of paper that has maybe a list of everyone's emails on it that you interviewed with that day. If that was the case, I sent each one of those a thank you. But sometimes they'd give you a paper and it said, just send all correspondence to the program coordinator. Well, then I would just send it to the program coordinator and tell her, you know, please let, you know, so-and-so know that I really enjoyed my time with them and please thank them for me. So I kind of used how the program coordinator disseminated the contact information to me. I used that as a guide as how to contact the program. Because you never know their preference, if they want a bunch of emails or if they don't. And so I sent a thank you to everyone. And then to the program that was my number one, I told them that they were my number one. And I made that very clear to them because I felt that it was important, even if I didn't match there, for them to know that I really wanted to be there. Because if I was a program director, I would want to know if someone really wanted to be at my program. So, and I was lucky enough to get my number one. So I'm very happy about that.
I think that is excellent. I did the same thing. Like my number one, I knew I wanted to go to Baylor. I told them they were my number one. I didn't lie to the other programs. I think I had like a top 3. And for the other programs, I told them like, you're on the top of my list.
Yes.
So I think it's okay, but don't lie because interview directors will talk to each other.
And you're going to work with these people, you know, at other programs, you're going to work with other physiatrists for the rest of your life. And so there's no need to burn bridges and tell everyone you ranked them all number one. You know, it's not,
It will leave a bad taste in their mouth and it can come back to bite you. Okay, someone asked, as a DO student, did you take the USMLE step 1 and 2 in addition to the complex, and how do you think it affected your application status?
So yes, I took both. For 1 and 2. And I think that, you know, for me, I wouldn't have changed that. I like that I took both because I think that it left no question in the program directors and program coordinators' eyes. The program I'm currently at, I don't think they would have minded if I just had COMLEX. They really are friendly to DO students. They, you know, are very open to OMM. They like the COMLEX. They have nothing wrong with it. But there were other programs that I'm not sure if they would have been open to just COMLEX. And so for me, it was worth putting myself on an even playing field so that there was no question. Because the easier you can make the application process for the program director and the program coordinator, the better. You know, I want them to be able to look at my application and say, you know, not have all these questions or, negative questions. I want them to be interested and be able to spend the time during my interview asking me about me and not like why I chose to do, you know, why I chose to take one test and not another or so. But it does stink that it costs us double the money. And that's, you know, that's really the problem with it. But I if I went back, I would still take both.
Yeah, I think the majority of students at TCOM kind of encourages us, I feel like, to take both the tests. Usually you take it like a week apart. So you're already studying for one, you already know the information. You just really study like that OMM portion during that week off, and then you go and take it. Someone had asked a really good question. Someone asked about how do you handle weaknesses when applying to an application and I can kind of answer that, and you guys can kind of chime in as well. I think if you have a weakness in your application, you have to address it. Don't try to make an excuse for it, because you will be asked about it. And you just address it head on and say, hey, this is what was going on during this time. This is how I recovered. This is what I learned from it. And yeah, just don't try to hide it.
I would agree completely. Yeah. I think to address it directly and not shy away, but also don't spend all your time talking about it. You know, if you got a bad board score and you're asked about it, tell them what was going on. You know, maybe you had some family issue and whatever, but then direct to how you've overcome that, you know. And I don't even want to say spin it, because you're not spinning it. You're actually telling people how you overcame that challenge. So if you had a bad board score, you know, say, this is what was happening in this life, but since then, you know, look at my step 2, or look at, you know, my clerkship evaluations. I really, you know, increased my knowledge and studied a lot more after that mishap, and kind of show them where you've come since that downfall.
I think that's a good question. Someone had asked us just about, this is kind of off topic a little bit, but about entrepreneurship or business opportunities available for general physiatrists. We kind of addressed this before. You can do, I feel like there's 2 types of people. You have either academic physiatrist, or you have a private practice in a group setting physiatrist. So you just have to kind of figure out which is the best fit for yourself, almost like residency. And
it's a good leeway, yeah, for what Nicolet does, because she's super active on Instagram and Twitter. So tell us a little bit about that and how you got into
blogging. Yeah.
So
if you don't follow her, please do it. She has amazing content.
Thank you. So interestingly enough, so I told you guys I was a nutritional science major in undergrad. And so actually it started off as a food blog. Like if you scroll way back in my Instagram, it's all food. Like there's literally not even one photo of me at the beginning. And I was just like, at that time I called myself like Nourished Studio or something. I don't know. I was in undergrad. And so then I started realizing when I started medical school, I really wanted to post about my journey. And I felt like I had something to say. And so that's why I changed it to Nicolet Life, because I wanted to be able to speak on anything I wanted to talk about. And I didn't want it to be just like one, you know, about one thing. And I think I've just really enjoyed sharing bits and pieces of my life. And while I don't spend, you know, there are bloggers out there who that is their career. That's how they make money. That's what they do all the time. And that's not me. That's not my goal. But I enjoy connecting with people on there. I've met some amazing people, you know, that become real life friends that you eventually meet in real life and they become your friends. And it's a great way to network. I would highly suggest that you don't have to want to blog, or you don't have to want to even post frequently, but I would get on Twitter, or, you know, Twitter is probably the best for professional right now. And just start, you know, following people in your field and tweeting about research in your field. I've known a lot of people that set up, you know, remote research projects and work on research together because they met on Twitter. And cool. Especially right now with COVID, even just someone recognizing your name, like, oh, you posted that research article on Twitter and they're interviewing you, you know, virtually for a PM&R position. That's big. Like even just a tiny bit of recognition makes you more likely, you know, they feel like they know you a little bit more. And I think that's important.
Yep.
Yeah, I think it's huge. So cool. I know. And just the reach, just in the short time that Sheena and I have done this, we've had so many people reach out, which is amazing. Someone reached out from Jordan, and we were like, this is like Ivana across the world. We're like, this is so cool. You know, we're like, we just are here to help. We feel like we give advice all the time. We've always have, and we always run things by each other. So we're like, we just have to help anyone we can.
Yeah, so I think just to reiterate what Nicolet's saying, like, especially on Twitter, like our field is so small, like, and we have such a big Twitter presence, like, you know, hashtag physiatry, or I think it's remember Benecia, we were in residency, like we were like trying to convince other people, you guys need to get on Twitter, like this was 3 years ago. And Dr. Gutierrez, Nicolet, you know, your chair now, like she has done like so much on social media, and it's Dr. Julie Silver, like all of these people are on there, and it's an awesome place to network. If you're not on, you know, you need to get on and make those connections, because you're not going to be able to do that in person now during this.
Yeah.
It's going to be really important during interview season to.
I totally agree. Someone asked a question, Nicolet, how many away rotations did you complete and how many do you think you see as enough to be competitive?
So I did a lot. I did 4. And
oh, wow. Yeah.
I was actually told by my residency advisor, my school has a residency advisor for all of us. And she was like, this is a bad idea. You're going to be burnt out. Don't do 4. And I was like, but I really want to see all these programs. So I ended up doing that. And I do not regret my decision.
Good.
I loved it. But I would say that's not necessary. You could pretty easily do 1 or 2, but I would, if things start opening up and there is a chance, with all of this COVID stuff going on, I know that it's not guaranteed, but let's say they move back the ERAS application time and there is an opportunity for you to do an away rotation in, say, January, I would say do it. Because it's so helpful to at least have an idea of what, even if you've done a 3rd-year rotation, like I did a 3rd-year rotation as well. But it's so important to see how other people practice and how different physiatrists implement different, treatments, or how they manage things differently, or even just that they practice completely different parts of physiatry. And I think it's important to see that if you can. Of course, this year's a lot different, but I would just try to get in as much of that opportunity as you can. I think 1 or 2 is a good amount of audition rotations.
Yeah, I did 2. How many did you do, Benecia?
I did 2. I did 1 in December and actually did 1 in January, which is kind of late because that's when the application season typically ends at the end of January. But it worked out in my schedule, so I was like, no, I think it's fine.
Yeah. How'd you do 4, Nicolet? Because I think was it all elective time or?
So my school allows us to plan pretty much our whole 4th year. We just have to do an emergency medicine rotation and a geriatrics rotation. And I was able to get those both in the spring. And so I did August, September, October, interviewed, packed as many interviews as I could in November, and then another audition in December, and then packed a bunch of more interviews in January. So I had, it was hard to schedule interviews that way because I was scheduling around auditions, and I didn't want to take more than 2 or 3 days off of a month rotation because being there, I felt was very important to show my interest. And I wanted to, I was there for a reason. And so I tried during those rotations to just take local interviews. Like if I was in Dallas, take another Dallas interview because that would only need me a day off, or, maybe an Austin interview that I could just drive 3 hours and drive back. But I tried to get most of my interviews in times when I was not auditioning.
No, yeah, that's very cool. Anyone else have any other questions? Let's see.
We talked about this a little bit with Dr. Sawad, but when you're rotating as a medical student, what advice would you give to those students that are doing away rotations?
So number 1, you do not need to know everything. It's important for you to come in with an understanding of PM&R and to have shown that you've studied and looked at books. I would suggest the PM&R Pocketpedia, the blue one. I don't know if it's changed color, but it was blue last year. And, study up a little bit so that you come in knowing some stuff. But if you don't know what they ask you, come back the next day and know it. And that's really all they care about, is that if they ask you twice, you know it the second time. And if you're interested and excited to be there, then they can sense that. Having a positive attitude is way more important than being the smartest person on the rotation. So of course, know your stuff, try to learn before you get there. But the reason you're there is because you're a medical student, not because you're a doctor already. So it's okay to be learning. And they want you to learn. They want you to ask questions.
Totally great. And someone told me good advice. I remember when I was a medical school student, they were like, if your resident does it, you do it. If your resident putting on gloves to do something, you put on gloves and act like you're ready. Even if you don't do it, you jump in just in case they hand you the needle. If they're listening to heart and lungs, you come right behind them. Listen to if they're range of motion, you check range of motion right behind them because it shows you're interested, you're trying to learn, and you're willing to jump in.
Yeah.
Yes, and I would even say, if you asked to perform procedures, they may tell you no, but that's not an issue. If you say, you watch them do a knee injection and say, maybe next time, would it be okay if I try? Ask, show interest. They want people to speak up. And I think a lot of people are afraid. And unfortunately, if you're afraid to speak up, sometimes it can come off as being uninterested, and you never want that. Even if you're just shy and you really are interested, they may not be able to see it if you stand quiet in the corner, so really work with them. And another thing is, like you said, if the resident stays late, I stayed late. Unless they told me to go home and they were serious about it, I didn't even ask. I didn't put on my backpack. I didn't say, oh, I have a workout class at 6. Nothing. Right. You stay there until they are seriously telling you to leave.
Right. I think that's excellent advice. Okay, last question, I think. Nicolet,
our go-to.
Our go-to in question. Okay. If you were not going to be a PM&R doctor, what would you be?
So if I didn't go to medical school, if that was off the table, I would have been a nutritionist. I think I really value nutrition, and I think that actually plays a big role into why I love PM&R, because it's very focused around health and wellness in general, and function, which I think PM&R or nutrition plays a huge role in that. But if I did go to medical school and never found PM&R, I probably would have ended up in family practice, because you can kind of, it's not, you can't do as much in the PM&R realm, but you can kind of get there, and you can, help people with nutrition and general life wellness. And so I think that's probably the route I would have gone if I never found PM&R.
Very good. Excellent. So I think that's going to wrap it up, since I don't think we have any more questions. Yes, follow Nicolet on Twitter and get Instagram. Please give them your handle so they know how to follow you.
It's nicolet.life, and it's NICOLET.life.
Yeah, follow us. Yeah. I'll let Sheena end us. How do you follow us, Sheena, since I mess it up?
Yeah, now we are on Instagram, Facebook, and we just started our YouTube channel. So just search for the Virtual Physiatry Mentors, and it'll come up. So I know, if you were late to this program, or if you missed our other ones, or if you know anyone that else is interested, you can watch our videos on Facebook Live. They're always on there. They're also on Instagram, IGTV, and our YouTube. So the YouTube videos are edited, so those first 2 minutes of us kind of figuring out,
we're like, are we connected? Is the internet working?
Yeah, are we frozen? Like what? Yeah, all that stuff will be out, so a little bit smoother on there. But yeah, we're excited with this next week. Actually, we have a doubleheader coming up, so we have a talk on Saturday and on Sunday. So on Saturday it'll be really exciting. We're going to be talking about interventional fellowships, so difference between ACGME sports medicine, which is what Benecia went to, a non-ACGME sports and spine fellowship, which is what I did, and then we'll have 2 of our other colleagues, one that did a ACGME PM&R pain fellowship, and then another one that did ACGME anesthesia-based pain fellowship. So that should be a great talk. And then on Sunday, our usual 6, and that talk is a little bit earlier, I think at 4. We'll put it on for Instagram.
Because we have someone coming from California, so.
Yeah. And then next Sunday, we'll have Dr. Yi Chu, who is finishing up. He just finished up his intern year, and he's going to be starting his PGY-2 year in PM&R. So we'll kind of get his advice and see how his intern year went.
Yeah, awesome. Thank you so much for joining us. We appreciate it, and you guys have a wonderful Sunday.
Thanks for having me.
No, thank you. Have a good day. All right.
Bye.
Thank you.
Bye.
Bye-bye.